Hi everyone, so we're going to go through case note writing. This is essentially where we input any notes based on our face-to-face experiences with our clients. And this is also how you get paid. Okay, so you're going to go to Theranos.com. You're going to hit login, and then you're going to use the email that you have used from the very beginning with us. Your password is password, all lowercase. Feel free to change it. Otherwise, at this point, your password again is password, all lowercase. Once you get to the main dashboard, you're going to go to this little grouping. Sometimes you might get pop-ups. You can minimize those. You're going to go to this grouping of people over here, and you're going to hit My Clients. Once you get to My Clients, you'll have John Doe right here. He is your practice client. Going forward, if you're given a case, you're going to email Megan. You're going to ask for what you're going to request for that client to be put on your dashboard, and Megan will take care of it. Okay, so any of your clients that you might have are going to end up here. You're going to hit John Doe, okay? And here you have all the John Doe's demographics. So if you scroll down, this is blank, but typically there will be an address. So if you're doing in home, you'll be able to access their information and know exactly where they live. So you know where you're going based on this demographics page. Okay, we're going to scroll up to the top. You're going to hit notes. And then here you'll have a list of case notes that every single person that's ever billed for them, this is where their case notes are. You're going to hit plus progress notes in this upper right-hand corner. And then you're going to hit standard note, create note. Okay. And here you have your note template. Let's say you had session yesterday, and then you had sessions starting at 3:30. All of our sessions are in 30-minute increments. Okay, so let's say we had session for 2 hours, we're at 120 minutes. Appearance, feel free to use the drop down, okay? There's plenty of options. You can input your own. Behavior. Use what's in the behavior intervention plan, okay? So you get a behavior intervention plan from your BCBA, you're taking data every session. What are you taking data on? These are the behaviors you're taking data on, okay? So non-compliance, let's say they have tantrums, aggressions, maybe some motor stereotypy, vocal stereotypy. Maybe they have some perseverative language. Okay, so use again what you're taking data on. Speech. Is their speech expansive? Do they not have much, like many words? So they're inaudible, they're hesitant, right? So this client, John Doe, is expansive. Affect. All right, this is visible external emotional state, okay? What are you observing at the time of session? What do their facial expressions tell you? Look at tone of voice, body language, use of hands. If affect is constricted, that range of intensity is kind of constricted. The affect is reduced, okay? If one's affect is flat, they have no sign of emotional expression. If one is in a normal range, maybe you see a variation of tone, variation of voice volume, hand movements, facial expressions. So in this case, we're going to say that John Doe is flat. Let's move down to mood. This is, something that's self-reported. What is the client's perception of the world? Understand that mood can fluctuate during session. Maybe at the start of session, they're feeling some anxiety. But as session goes on, maybe they're feeling a little bit, I don't know, they're in it. They're moving, they're grooving, they're in it. So you're able to create notes based on their moods throughout sessions. If we're going to move down to appetite, If this is affecting your session, feel free to input it. If it is not, you can always put non-applicable, but if you think it's causing behaviors, if you think it's having an impact, feel free to input here. Risk assessment. For John Doe today, we're going to put not present. Please understand that if a client reports that they are going to harm themselves or harm someone else, you are reporting it to your BCBA. If you're in danger, you're calling the police. Always report to your BCBA. It's super important to have communication. We have systems. If a client turns around and says that they're going to harm themselves, most often we stop sessions. We put sessions on hold until they are assessed by an outside provider or somebody within Baker Street. And they have to be medically cleared to ensure that they're not going to harm themselves or anybody else that's in the home. So please ensure that you are reporting any I want to harm myself or any other statements that are not comfortable statements and that could put you or someone else in danger. Here we're going to scroll back up to session focus. I am going to put my first and last name here. And I am going to put ABA therapy. You will see in that list of case notes that there are people billing parent training, supervision, they're billing social skills group, reassessment. You are always billing as therapists, ABA therapy. Unless you're a BCBA, then you will be billing the other supervision, reassessment, social skills. You might be attending social skills group with your client. You are not billing social skills group. You are always billing ABA therapy. Session focus is that overarching, what are we working on in session? What did session look like? Okay, so I'm going to put use of behavior intervention plan. I'm always putting use of behavior intervention plan. We're always using it. Increased compliance with non-preferred tasks. This might be something we're working on in session. Skill acquisition programming. We might be working to decrease maladaptive behaviors. And these are these behaviors we want to decrease. This is that non-compliance, the tantrums, the aggressions, the motor stereotypy, the vocal stereotypy. So here we are again, use of behavior intervention plan, increased compliance with non-preferred tasks, skill acquisition programming, decrease maladaptive behaviors. We can keep it short and sweet. But once we move to therapeutic intervention, this is the meat and the potatoes of what we did. So what is helpful is for you to take a picture of the data sheet, okay? So take a picture of the data sheet at the end of session so you remember which programs you've worked on. Some days you might not work on every single skill acquisition program, but you're always taking behavior data, right? At least knowing what programs you worked on for that day, that's pretty helpful. So if we're going to go back up to session focus let's backtrack a little bit before we go to therapeutic intervention. I might want to list some of these programs we worked on. Okay, so maybe we worked on increase conversational turns. Maybe working on noticing disinterest in conversation. Maybe we are working on functional communication, zones of regulation, independent use of coping skills. Let's see. We can keep it like this. Of course, you might have more, but for today's today's note taking, let's keep it short and sweet. Okay, so therapeutic intervention, again, this is the in-depth response to your session focus. We might go a little bit deeper into talking about what happened when you arrived. Upon arrival, client was excited to see writer. I call myself a writer. This is what was taught to me years ago. Feel free to call yourself a therapist, whatever works best for you. So upon arrival, client was excited to see writer. Writer gave client a transition warning and set a timer. So essentially, the therapist walked in and she was like, John, you have 3 minutes, and then we're gonna transition to tabletop work, okay? Okay, client transitioned to tabletop work with little to no prompting. Client, writer chose 2 programs. Client chose 2. Why do we do this? It increases the likelihood that the client has, they want to do it, the programming. They have buy-in at this point. You're choosing to, they're choosing to, you're creating behavior momentum. So writer used a whiteboard to write out session schedule in order to increase behavior momentum. Now they know what is expected of them. There's no questions. They just have to go back to the whiteboard for those transitions to be reminded. And we're going to go back to that session focus and look, okay, what programs did we work on? Client was able to increase conversational turns from 1 to 2 on a preferred topic. When writer changed the topic to something of less interest, client needed multiple prompts and a cue card to assist client with the appropriate language to maintain the topic. So I lifted up a cue card. It might say some WH questions that help keep that momentum, and that gives that client that opportunity to have the words to actually maintain the conversation, gives us the opportunity to then reinforce them. Writer provided client with signs of disinterest. Client was unable to identify disinterest in conversation without assistance. Okay, so I twirled my hair, I looked away, I put my eyes down to the floor instead of making eye contact, and my client at that point was not able to identify that I was no longer interested in that conversation. When provided with zones of regulation, client was able to identify the red and green zone at 90% of observed opportunities. Okay, so I want to include some percentages in here. That way we have it. The BCBA is, not on site that week. They want to look back and see what you guys have done, what progress has been made. There's some percentages there. You don't need every program percentage, but it is helpful to have some. Okay. client became heightened during transitions and needed visual cues to assist with coping skills. Client was able to follow through with volcano breaths and counting procedures to calm down. All right, so we talked about some of these programs. Let's gear ourselves towards talking about those maladaptive behaviors. Client had a rate of 7 instances of noncompliance. One instance of tantrum behaviors and high levels of vocal stereotypy. Okay. So we talked briefly about these behaviors. This is short and sweet. Okay. Again, this is just a practice note to show you guys a little bit about what this looks like. Your planned intervention, again, use of behavior intervention plan. This is why we're here. And then after that, in-home behavioral therapy, center-based, what does that look like? Okay. So here is our note. We are going to go up to save and e-sign. I have my signature right here. I'm going to sign that document. Here's your note, all signed. You can always go back to these notes, so go back to progress note. And here's a list of all of the notes that you guys have ever written. All right, and that is about it. Hopefully this helps you guys. If you have any questions, always feel free to reach out. Happy note writing.